Good day, everyone. I'm Claudette Christine Yu, and before we get into the interview, I wanted to tell you what interprofessional collaboration is. According to the WHO, interprofessional collaboration is a collaborative practice which happens when multiple health workers from different professional backgrounds work together with patients, families, carers, and communities to deliver the highest quality of care across settings.
Hi, I'm Edward Daniel Mortelia. I am a medical doctor as well as a registered nurse.
Hi, I am Camille Gracie Carandang and I am a registered medical technologist.
I'm Anel Tapik, a pharmacy assistant at Watson's. I'm 5 years in counting here in the company.
Hi, I'm Gez Joyo. I'm a licensed physical therapist and I work as an associate professor in the field of physical therapy in Southwestern University of Inma. I also work as a clinical instructor at Vicente Soto Memorial Medical Center and at the same time as a practicing physical therapist in Southwestern University Medical Center.
What do you think dentists do?
I do think that dentists play an important role in the healthcare team. Well, they have their own set of scope, their practice, their education, and their licensures. But I think that they specialized on oral structures, specifically on the teeth and structures surrounding and supporting it. They can provide medical or surgical interventions when the need arises.
Dentists are doctors who specialize in dental care and hygiene. They practice prevention, diagnosis, and treatment of any diseases relative to oral health.
Usually dentist is the one who do some tooth extraction, do some certain things about teeth or mouth, yes.
Dentists are medical professionals whose duties include counseling and instructing patients on oral health issues and at the same time providing preventative and restorative care and managing a number of disorders that affect not only the teeth but also the gums and the mouth as a whole. The general responsibilities, so far as I know, of a dentist include performing examinations, which are also alike with how other professions, in terms of the health and allied health professions is concerned. Performing examinations of the head, the neck, and the mouth's hard and soft tissues, diagnosing dental disease, taking radiographs. They essentially evaluate imaging studies, particularly taken in different views, which helps in ruling in and ruling out differential diagnosis. And of course, developing treatment plans, maintaining clinical records, and coordinating with specialists and other health and allied health professionals, and frequently participating in operation of the practice.
Have you ever collaborated with a dentist in patient management?
Yes, I did have several collaborations in the past with a dentist, most especially if patients' concern are about toothache and the like. So if I do think in my professional opinion that it warrants the expertise of a dentist, then I do not or would not hesitate to refer them to a dentist that I would know. This is so that they can get the best medical care possible. And of course, when the management needs an expert on that field, then dentists are very adept on their services.
I may have collaborated with dentists in our clinic when they send us patients with requests for tests such as complete blood cell count. This type of test will give the dentist necessary information whether to push through or not with their medical plan. A complete blood cell count includes a differential count, which will give data regarding present infection, may it be bacterial, viral, parasitical, or fungal. When a patient is currently having an infection, they are not allowed to undergo any dental procedures as it may complicate or worsen the infection.
Actually, I have a niece who are dentist and she's now in the US.
In terms of management, I have never worked with a dentist, whether it be in relation to a patient who may have a classic pathology affecting any oral structure, or a patient in rehabilitation medicine who may have comorbidities that call for the interprofessional consultation, specifically with a dentist.
Have you ever collaborated with a dentist in other means?
Well, when I was practicing as a registered nurse, I did have several occasions where I joined medical and dental missions, and I was able to work hand in hand with the dentists back in the time, and it was really a good collaboration and teamwork with other healthcare teams. So not just with the dentists, but we do have other personals working side by side with us. So teamwork and collaboration really gets the job done. And hopefully, as a medical doctor, I do get to broaden and widen my scope so I can work with dentists as well.
Unfortunately, I do not think that I have collaborated with a dentist in other means.
I know.
I am aware of supplementary physical therapy areas where we can provide or link our practice to that of a dentist. I am referring to interprofessional collaboration between dentists and physical therapists. For example, we can work on carrying out patient transfers using proper body mechanics and pertinent techniques that will help address the needs of those patients who have been referred to dentists with mobility issues. But going back to the question, I haven't worked with any dentist yet in relation to these practice areas.
How do you think your profession can work with a dentist on a patient?
Well, as doctors, we do have a broad scope when it comes to our patient care, and common scenarios are actually those of toothaches. So, especially with pediatric population, when there is tooth eruption or when there is a cavity involved, then we can give first aid or a supportive management. However, it would be best if we can refer this to dentists so that they can provide their expert opinion on the matter, and they can also provide the correct management when it comes to tooth care.
Dentists and medical technologists, just like any other healthcare profession, work hand in hand to provide ultimate patient care. My profession is definitely vital for dentists as we can provide information regarding the patient's current health status.
Usually a pharmacy assistant is the one who take over like the certain things such the prescription-based medicines. We are the one who cater that, especially the dentist will prescribe some antibiotic medicines or some other medicines that are need a prescription.
The Rakabado exercise, which is specifically used to manage temporomandibular joint pain or disorders, is one particular set of exercise that I am quite aware of as a humble student in the field of physical therapy, and which is thought to provide a link as to when we might be able to collaborate with any dentist further in terms of patient management. Physical therapists can also assist in terms of restoring correct joint play, and at the same time, restoring joint play that will eventually help patients move their temporomandibular joints properly, since dentists provide management on any diseases involving the somatognathic system. And there are several journals that prove this. But just like any other professions, having a license does not necessarily mean that one has mastered the necessary skills. So if I were given the opportunity to work in this area in particular, I believe I would need to take a series of training courses in order to develop the necessary skill set.
Hi. Hello. Aloha. Welcome. I wanted to speak on my perspective about interprofessional collaboration. I think that interprofessional collaboration is such an important aspect in the healthcare profession, wherein we are bound to be in need of advice from other professionals out of our field on how we should continue further with our treatment of our patients. In my interview that I've conducted, I have interviewed 5 different professionals, namely from the field of medicine, nursing, pharmacy, physical therapy, and medical technology. After conducting those interviews, I realized how it is such an important thing to be able to reach out to other professionals, as there are instances wherein in our knowledge on a specific case is limited, and that is why we may need to consult other professionals on how to appropriately deal with these types of cases in order for us to prevent any complications or prevent any risks from happening towards our patient, because we should be patient centered when dealing with our patients, when taking care of patients or whoever may come to our need. I've learned that although these other professionals are not mainly focused on the head and neck, or more specifically on the oral cavity of a person, they are also very much in need, because they may have the knowledge that we don't about certain aspects of an individual's health. We may be able to encounter patients with comorbidities wherein we may have respiratory problems or cardio problems, and although we have studied about these parts of an individual, our knowledge is not centered toward those aspects, and so we are in need of advice from medical professionals. When we encounter patients with high risk of infection, or have infection at present with them, we may consult a medical technologist in order for us to determine which aspect of the patients have irregular results, such as maybe a patient may have high WBC or very low platelets. In terms of medicine, we have to be able to collaborate with pharmacists in order for us to acquire those medicines to be given to our patients, to treat them, to pre-medicate, or even post-operative medication to be given. Basically, healthcare professionals from different fields would have to work hand in hand with each other in order to prevent any unwanted complications or risks that may happen to our patients, and for us to provide also better quality healthcare. Yeah.